How do thyroid autoantibodies relate to autoimmune disease? Imagine your immune system as a vigilant security team, always on the lookout for threats. Sometimes, this team gets confused and mistakenly targets your own body, leading to autoimmune diseases. When it comes to the thyroid gland, this confusion often shows up through the production of special proteins called autoantibodies. These autoantibodies are immune proteins that mistakenly recognize parts of the thyroid as foreign invaders and attack them. They are key markers of autoimmune thyroid diseases like Hashimoto's thyroiditis and Graves' disease. In Hashimoto's thyroiditis, the immune system produces antibodies such as thyroid peroxidase antibodies and thyroglobulin antibodies. These target enzymes and proteins in the thyroid, causing inflammation and destruction of thyroid tissue. Over time, this damage can lead to hypothyroidism, where the thyroid cannot produce enough hormones. On the other hand, in Graves' disease, the immune system creates thyroid-stimulating hormone receptor antibodies. These antibodies stimulate the thyroid excessively, leading to hyperthyroidism, which causes symptoms like rapid heartbeat, weight loss, and nervousness. Interestingly, these autoantibodies can appear long before any symptoms show up. Some people may have these antibodies without feeling unwell or having abnormal thyroid tests. This means they are at higher risk of developing thyroid disease later on. For example, women who have just given birth or individuals with a family history of autoimmune diseases often have these antibodies beforehand. Thyroid autoantibodies are also linked to broader autoimmune conditions. They are more common in people with diseases like systemic lupus erythematosus or rheumatoid arthritis. However, not everyone with these antibodies will develop thyroid problems, which shows how complex autoimmune responses are. Factors like genetics, immune regulation, and environmental triggers all play a role in whether these antibodies cause disease or remain harmless. Testing for thyroid autoantibodies helps doctors diagnose autoimmune thyroid diseases accurately. It can also predict who might develop thyroid issues in the future, especially if they have no symptoms yet. For people with other autoimmune conditions, checking these antibodies can guide treatment and monitoring strategies. Levels of these antibodies often reflected how active the disease is, helping doctors decide when to adjust therapy. Understanding the role of thyroid autoantibodies highlights how interconnected our immune system and thyroid health are. Recognizing these antibodies as markers of autoimmune activity can lead to better management and early intervention. If you suspect thyroid issues or have a family history, talking to a healthcare professional about antibody testing is a good step. Remember, each person's immune response is unique, so personalized care is essential. Staying informed and working closely with your doctor can help you live well with thyroid conditions while keeping your overall health in check.